that on your end. Everyone all set? So for our media, we think we have figured this out so that you can take this live or share it live to a Facebook page, social media website, also that you are given permission to record this so that you can use it for your own purposes as you need to at a later date. So we want to welcome everybody to our daily briefing here today on the 31st of March. You should be able to record. You should be able to also be able to take it live if you'd like to. We're going to go through some information that we have for you, and then we will take questions in the chat room at the end of our information session here today. So first we're going to hear from Health Commissioner Eric Jasinski. He has our numbers for today. Eric.
Thank you, Chris. Yeah, today we have 112 total cases. Unfortunately, again, 3 deaths. 61 of those cases are male, 51 are female, and then the age ranges are 19 to 98.
Okay, so those are our daily numbers that we have. Again, additional cases, no additional deaths, which is obviously a great thing for all of us. And we look at those numbers every day, Eric. We know they don't give a complete big picture of what's happening in our area or how many people are infected because there are a limited number of people getting tested. But thanks to a partnership with the University of Toledo, we might have a new tool that will help us get that bigger picture that we're looking for. And you're asking the general public to participate in that.
Yes. A couple weeks ago when this all started, looked at the inability to really do the testing, really felt that we needed something else for this community. And who do we turn to? Of course, who we've been turning to a lot lately is the University of Toledo. Again, I can't say enough about University of Toledo, how exceptional they are in everything that they do, but especially our connection with the School of Population Health and Joe Dake, Professor Dake. He and I talked about this this project, if you would, to help our community. And he's been working diligently on trying to get this up off the ground with myself and a number of other individuals in the health department. And really,
if you could, Eric, first just kind of show the snapshot of the, the data that we have now. You have a map, right, that shows kind of the data we have now.
Right. And can we get that up? There we go. All right. So again, this is something that we're trying to do. Again, we try to bring you graphics the other week. We're trying to figure out how to, get this information to the community. And I think we have something now, which is, if you would, a zip code map of cases. And again, we're not going to drill down into specific cases or areas, but we're just going to use zips from now on. We're going to try to work this into the explanation of what's happened in the community. But again, much like the testing, this is an important tool for us to understand what's happening in our community. But again, this is only one tool. If we had more testing, but this would be better. So we need to come up with something different, something that can actually give us a better understanding of what's happening in the community. So what are we asking? What are we trying to do? What are we asking? Well, the idea here is to look at a self-reporting system. Now, again, what we're trying to figure out here is how we can get information from the general public back into us. So again, we can use that zip code map, the testing, other things that we're trying to do in the community and meld them all together and get a better operational picture of where we're at in the community relative to the disease. So it's going to be able to do a couple things. Hopefully, we'll be able to look at areas of hotspots as we come in the next 7 to 14 days, be able then to go ahead and get information to those areas or resources to the areas, or at least know what's happening in those areas so we can make a better determination of what we need to do in the community. Again, this is a self-reporting system, and I really wanted to caution us. This is for just Lucas County residents at this point in time. It is a self-reporting tool, and what does that mean? That means that you're going to have to be honest with us. It's going to take you through a number of things. It's going to take you through some demographics, so who you are, a contact number. It's going to take you through an ability to link to the CDC and ask, if you would yourself, do you have symptoms and what are those symptoms? It's going to go into then a reporting system of the actual symptoms that you have. And then as you push the button, it's going to go ahead and get that to us. Here's the important thing, is that it is HIPAA compliant. Again, we want to make sure of that because, again, this is some sensitive data. So Dr. Dake did some real due diligence in getting this thing up. Well, we vetted it through the department as well too, and we think we're okay. The thing that we're really trying to do here, again, is give the community the ability to help us understand what's going on out there. And as long as we're honest with that survey, we're going to be able to get a real good operational picture, we think, from this data. Also then too, and we can't make this promise, but what we're going to do then too is have the contact names and numbers that if we have resources at that point in time, we might be able to give you a call back and help you out. Again, that's another thing that we want to do, that we need to get online, but we really felt that this was important to get up and running so that, again, before we have the next 7 to 14 days and some real issues possibly, let's start this process now. Now, again, we're looking at some other things too. Again, we understand that we need to look at different languages and things of that nature, and we're trying desperately to do that at this point in time, and I think we have a way to get that up and running by the end of the week, I'm hoping. But it's important to start this now. So again, we need to help each other out. If you have family members that might have a hard time with understanding the form, help walk them through that over the phone or whatever you can do. But it's important for us to get this thing going now so that we can get some really good information. I think too, it might help us too as individuals to just look through that and maybe get a sense of calm to say, okay, at least we're able to tell people what we're experiencing. But again, please, I caution everybody, if you're using this form to not be accurate, it's not going to help us, and it actually could have a detrimental effect of trying to figure out what's going on in the community. So please take a look at the site. Again, we'll tweak it as we need over the next couple days. And again, I want to really thank University of Toledo. We do not understand the treasure that we have in our own backyard. Not only with the testing that's come online, now this survey, the School of Population Health is also helping us out with epi capacity, and then possibly to do some callbacks with this form as well. We really need to just be thankful that we have an institution like that in our backyard that we can do so many things with and for. And I'm really appreciative of Dr. Dake and all he's done for us so far. So Chris, I don't know, any questions?
We know that information and data is one of the biggest weapons we have right now against this COVID-19 crisis. So this is going to be great information. Again, we want to give you the information so you can connect, and that is the website for the health department. What you're going to see is a connection there. I'm trying to put it up on this screen here. This is what it will look like. It talks you through some symptoms and some other questions, and that's at lucascountyhealth.com. lucascountyhealth.com. So if you are having some of these symptoms, if you can give us a heads up, this also would help our epidemiologists to see hotspots in our community and to get a bigger picture, to use that data not only for now, but to use it in the future if we ever need to worry about that in the future. So very important tool, and that's going to be very helpful. Glad to have the University of Toledo on board to help with that. Eric, the health department has been getting lots of questions from people about businesses that may not be considered essential that are open, or essential businesses that are open but may not be complying with the state regulations for staying open during this crisis. So can you give us updated guidelines on this and what the process is for people who might have a complaint?
Sure. It's similar to what we've been doing over the last week or so. It's just that we've been able to streamline a little bit more. Again, every system that we have in place, we need to tweak because, you know, working in this environment, it's much different than what our systems were set up for before. So again, had to work through a couple things. And really what we're looking for, remember, we don't want those non-essential businesses open. And, you know, the general public has done a really good job about calling and I don't want to say complaining, but discussing those non-essential businesses and, you know, what are they and where are they at, and getting some information from them so that we can make a call back and find out really, are they an essential business or are they not? Also then too, we've had some calls, and thank you very much, from individuals who have went past maybe a restaurant or another facility, that there might be people standing outside. Maybe they look like they're not social distancing. So again, we've been able to follow up with those as well too. Again, please remember, if you're going up to a walk-up counter, like at a ice cream shop, that's great. Make sure you're staying with your family units. Make sure that you're 6 foot away from each other. Businesses, they've been doing great. They've been putting cones out or Xing on the concrete or what do they need to do. And we got to make sure that everybody's doing that. So with that said, again, call the department at 419-213-4161, hit option 4. You're going to leave a number, all right, and a message about what is the concern. We have individuals pulling those messages off, and then we actually have a number of our public health employees that are making callbacks and being able to have those discussions with individuals to really see what's going on. Again, we've been calling, and there might have been a misunderstanding with like a walk-up ice cream store where they thought that people were congregating too close to each other, but actually were family groups standing 6 foot apart from other individuals. And again, that's what we want. But again, I caution us, if you don't have to go out, don't go out. If you don't have to go out as a group, don't go out as a group, all right? So there are some things that we probably should talk about too, that, I don't want to talk about penalties, but again, there's things that we need to do to make sure that we can go ahead and enforce this. And again, we have some tools, but what we want to do is just get the community to keep on doing what they're doing. And that's adhering to that social distancing and making sure that if you're not non-essential, you shouldn't be operating.
And I would say that most businesses are probably trying very hard to comply, and maybe they, aren't aware of something that has been put into place, and they just want to do the right thing. But as you said, there are some penalties for some of this, and Toledo-Lucas County Emergency Operations Public Information Liaison Gretchen DeBacker has been in touch with all the parties about that part. So let's talk a little bit about that and how that surveillance and how the penalties for that work, Gretchen. Gretchen, we can't hear you.
Can't hear you, Gretchen.
Sorry, guys.
It's all right.
There you go.
Am I unmuted now?
We've got you unmuted.
Sorry. Yep. A lot of municipalities in the county have been dealing with this exact issue, and we have been attempting to, as Eric said, streamline this process. We are hoping that residents and businesses in Toledo and Lucas County continue to adhere as best they can to the guidelines outlined by the state of Ohio as well as by the Toledo-Lucas County Health Department. We believe that the ability to call that number, 419-213-4161, to report one of 3 main topics, which would be, I feel like I am an essential employee and my employer is not complying with what they're supposed to be doing. The second most common piece of information we get is, I don't think I'm an essential employee and I'm still working. And the third thing is about businesses in general, mostly restaurants. I was at this restaurant and this is what happened, and people were standing close and they were letting people inside. Those are the main types of calls and concerns that we are getting in. You can use this number, the community, the county can use this number moving forward for all of those concerns. As Eric mentioned, there will be about a dozen individuals from the health department that will be retrieving those messages and reaching out to these businesses in an effort to ensure their compliance. And if that doesn't work, we are working with all of our law enforcement partners in the county to go out to those sites that are refusing to respond to the health department or to respond to the compliance measures that are in place statewide, and will enforce that way. But that hasn't happened yet in the county, and we hope it won't. But the message we want to relate today, hopefully, is clear that that is an option that is available to us.
Okay, so calling the health department would be the first step in that process. We know there are not a lot of places to go right now. People get a little stir crazy at home, and we've been encouraging people to get outside and walk and enjoy the outdoors. but there are also some restrictions to that under our current order. So Gretchen, talk about what people can do and cannot do at our public parks and how those restrictions might be patrolled as well.
Yeah, so we've mentioned this a few times before. We can expect some further communication from Metro Parks Toledo and the Toledo-Lucas County Health Department in the Blade coming up here tomorrow. But essentially we know we need fresh air, and people need to get out of the house with their family units and stay with the people that they are living in their home with. But should you approach a park, an open area, or walking on the street, the 6-foot distancing must be adhered to. And what we wanted to communicate today is that both in Metro Parks Toledo and at City of Toledo Parks, the efforts will be ramped up to enforce those guidelines. And what we're hearing from both City Parks Administration officials as well as Metro Parks officials is they want to stay open. They really do want to have these open nature spaces for people, but they need the cooperation from residents to ensure that they can stay open. The health commissioner has previously mentioned, and we call your attention again to the inability to have group sports activities. So basketball and football and any kind of touch sports or an item that would be shared, a piece of equipment that would be shared between and among people. Those types of activities shouldn't be happening in either the Metro Parks or the city parks. And just another advisory, it's supposed to be 60 tomorrow. Stay warm for the rest of the week. We expect people to be outside, but those advisories remain in place for the open spaces.
Okay, and I think the biggest message here that we're trying to get out to people, you would both agree, is that if we do the right type of self-policing on all of these issues where it comes to businesses and food and getting outdoors, that we will still have access to all of those things that we, the few things that we have access to right now, right, under these stay-at-home orders. So we are going to open to questions right now. Any of our media members who are on the line can type those questions in the chat, and I will be sure to refer them on to Eric or to Gretchen. Are there any questions from anyone out there? There is a question, Eric, Spanish-speaking members of our community, can they call that same line and have somebody call them back and or take their complaint?
Yes, we do have Spanish-speaking individuals in the department who can probably field those calls without a problem.
Okay. Any other questions from our media for today? From Diane Larson at 13 ABC, County Commissioner agenda for today, housing first responders and people recovering who don't need the hospital. Why is that needed, and how many units will they get in? And I think, Gretchen, you were in on those meetings today, if you want to address that.
Yes, the question is about the County Commissioner's agenda today. They approved 2 resolutions for spending. They approved those resolutions unanimously at the Lucas County Commissioners meeting today. Essentially, this is just another step in the planning process to prepare for the situation that we are in. This housing would be primarily secured for first responders and medical personnel who, for a variety of reasons, would need to be quarantined and or isolated. These could be people that are symptomatic or that are asymptomatic. And this housing is, this approval of the Lucas County Commissioners to spend this money allows the director of the Emergency Operations Center to proceed with pursuing contracts for these locations to secure this housing if and when it becomes needed.
Okay, Gretchen, thank you. Any other questions from our media? Nothing else today. Oh, here comes another one. Okay. The governor said today, this is also from Diane, that he expects regional plans about hospital buildup to be released by tomorrow. Do we have any update on that locally?
Diane, that is our update as well. So we await that information.
Renata is asking from WTOL if the form will be available in different languages, the community survey, Eric, that you're talking about.
Yeah, as I mentioned, that's what we're trying to do right now. Hopefully by the end of the week, we'll have that in different languages.
Okay, and we are talking about Arabic, Spanish, and Mandarin in addition to English, is my understanding, correct?
At this point in time, yes.
Okay, all right. Any other questions from our media for today? I want to make sure everybody's questions are answered. If you have a question and you didn't hear, you can type it in the chat on the bottom of your screen there. All right, guys, I think that might be it for today. So
Great.
Thank you.
Thank you.
Thank you, Gretchen. Thanks to all of our media for participating today. And we'll probably be back in touch with you tomorrow.